Well, one thing I'd like to ask our audience here today, what do we do and whom do we turn towards in our darkest hour of need? Many would say God, well, perhaps that, but after that, it's usually technology. I think we'd agree with our panelists here, and one of the words which has been, especially in the pandemic years, been added to our vocabulary has been that of digital health. In fact, that has been one of the biggest pushes which has been made over the last few years, especially during the pandemic. But what does digital health really mean? It is essentially the confluence, if I may call it that, of technology and healthcare. How to use technology to improve healthcare facilities for the people of India. And what's going to be the roadmap after all? Let's not forget, this is one of the most populous countries, but the resources are limited. Hopefully, we'll be able to chart a couple of the roadmaps, the initiatives which needs to be taken with the help of our panelists here today. So I'm going to start with you, Mr. Babu. And this is an interesting time to have you here on the stage because Andhra Pradesh just won 2 Global Digital Health Awards. Many congratulations for that. That is for linking 1 crore e-health records. Huge milestone there in India's healthcare system. However, how are you going to use these initiatives to ensure that we are making the system pandemic-proof?
Yeah, actually, COVID, we all know that it has really shook us up. We were not having that kind of both infrastructure-wise as well as reach, because we have to reach to all the hospital stakeholders, the people. So naturally, the technology has given a lot of edge, because as soon as this particular problem has come, our government has started 104. There is a call center with proper backup record about just informing the people, because information was key. Everybody was worried, everybody was in a panic situation. So whether you send transport to the people, whether you organize admissions in any hospital, to understand which hospital has the beds available and what kind of concerns the people have. So all these we were able to address by massively improving immediately the digital technology at our command, put the call centers, put the IT platform in place to make the people aware that this is the hospitals which are having beds available. You can go to these places, and information, because not to create panic. Creating confidence that you can be staying at house, and we will be able to guide with the help of the doctors. So the telemedicine.
With the touch of a button with your phone.
Pardon?
With the touch of a button in your phone itself.
So the calling also, telemedicine also, it has helped a great extent. Almost with the help of Indian Medical Association, we had onboarded many of the private practitioners along with government doctors to take the calls, to guide them, to follow up. So all this was possible because we were able to use the technology much better. Subsequently, of course, you know, COVID, all that kind of vaccination, how to track the patients, how to treat them. So surveillance in every step, because almost 100% of the people have to be surveyed. We had a fever survey, almost 48 rounds of fever survey we have done in the entire population. So each of the family, each of the house is visited by A&M, and their data about anybody is having fever or something is put in app, such that they are tracked to ensure that they get the proper treatment, proper admission if it is required, etc. So this has really helped us a great deal.
Absolutely, especially in the rural areas. But Dr. Arora, you are now heading the apex body which has taken all the policy decisions when it comes to vaccination. 97% of Indians today are vaccinated. Again, another round of applause for that. How has digitization of health helped you reach this milestone?
So, thank you very much. So, this is an important question, and the brief answer is that pandemic was not taken as a tragedy, but as an opportunity. And the preparation started somewhere in the last week of February itself. All of us knew that vaccines will be required. This important point was that everybody has to be immunized. And it means adult immunization. I'm a pediatrician, so pediatric immunization and maternal immunization has been there for 50 years. But adult immunization and then 1.4 billion. And this couldn't have been possible because we have to manage, keep a record, and kind of remind them and see how many are immunized and not, in the context that vaccine was not freely available. There was a limited supply. So the preparation for IT-based solution started right in the first quarter of 2020. And by July, a very specific platform had started taking a shape. India was already using a platform to monitor vaccine availability at various points and cold chain. It's called EVEN. That backbone was used to get client information on that. As a result, we have COVID in front of us. But the most important part of the COVID is that it not only keeps an account of who has got the vaccine, how many doses, and it also sends you reminder, but it also has a inbuilt two additional mechanisms. One is, what is the amount of vaccine available at a particular center? This is real-time information available back-end. And the most important, and I think Dr. Babu and everybody will agree, what IT brings is accountability. You must have noticed in your immunization certificate, the name and the name of the immunizing person or the vaccinator, date, time, and place is written. So if there is a problem, we know who was the person who has given the injection. And same philosophy is being followed up in all our programs now, that along with access, reach, quality, accountability will come in healthcare as we move into a digital health scenario.
That's very interesting. It's not just about dissemination of the technology and medicines, but also accountability. In fact, something that Mr. Babu had picked up, and I'd like to take that up with Dr. Rittu Garg as well. Telemedicine, something that has been mentioned. Now, when we see a rapid rise of that in our country, for example, in North India, about 80% of the doctors have been connected, 50% in South and the Western region, 35% in East India. How do we ensure that it reaches 100%, especially in the rural areas, given the importance of that?
I think what we've seen is there has been a massive adoption, obviously, post-COVID, for and during COVID about the telemedicine, and awareness is the starting point. And once people are comfortable with the technology, and when I say people, it's not just the people who are seeking healthcare, but also the caregivers or the healthcare providers who need to be extremely comfortable with the idea of the technology. So that has obviously catapulted into a significant increase. Now, to reach to 100%, the one would be the infrastructure. Many times, we spoke about 5G in the previous session, and I think the connectivity and the seamlessness of the experience is going to be significant for us to be able to get to 100% connectivity between the rural healthcare need as well as the providers which are concentrated in the metro areas. The second would be obviously the larger number of people who get empaneled through the systems. Now, with the digitization of the healthcare records and the ambitious program about the portability.
I'm sorry to interrupt you, Dr. Garg. I believe there is a problem with your mic. Dr. Babu, if you don't mind, could we...
Just taking from her, in Andhra Pradesh, what we have done is we have village secretariats for each of the 2,000 population. So that is one experiment the present government has taken up very prestigiously to bring the administration close to the people. Each of this is having a village clinic. So this village clinic is having one BSc graduate as a community health officer, then ANM and 4 Hasha workers. So almost 5 to 6 people of this caliber, they are available. and each of this center is provided with telemedicine facility. So we have connected them to nearest PHC as well as district hub. District hub is having a specialist of all the specialities such that the people can call any to the PHC or to the district hub if at all specialist services are available. The prescription is online and it can be downloaded. The diagnosis tests also can be just prescribed, where the diagnosis tests can be done at the village level and it can be uploaded such that the doctor can give the information. As for information, every day 60,000 people are on average getting this telemedicine services. So almost, as you are aware, 1/3 of the total telemedicine calls from India are from Andhra Pradesh. So almost 60,000 calls every day. It has really transformed because it will avoid the people going to the far off places, leaving the work, etc. They can go to the nearest village clinic, just call the hub and get whatever medicines they require. So that is really useful.
That has been proved to be very useful. Now, Dr. Garg, if I come to you, and it's interesting because he's talked about the needs and requirements of the patients. And we are talking about technology. Many would say that human emotions, Dr. Garg, is very different and perhaps even contradictory to technology. How are you going to reconcile a patient who's in pain, who has emotions, dealing with emotions, to reconcile that with technology?
It's a great question. And in healthcare, you can never get to 100% technology or digitization. There are certain aspects of a doctor-patient relationship that have to remain humane, and they will always be humane. So if we talk to our patients inside our hospitals, and we run a chain of 27 hospitals, and we've also embarked on a journey of digital transformation. There's a lot of brainstorming that we did on what is it that we want to digitalize and what is it that we want to keep, not digitized so per se. Any interaction that is happening between a doctor and a patient, doctor and a nurse, doctor and a GDA who's there, a counseling between an attendant and a doctor, it has to be as personal and as non-intrusive by technology as possible. It has to be. Whereas all the allied services, what is it that people hate? People hate standing in queues. People hate waiting for a long time to get OPD appointments. People hate, getting into long queues for billing. Now, those are the several areas that definitely need digitization. And here, I'm also talking about an urban patients. And of course, there are needs for the rural patients as well. But if you look at the entire spectrum, there are different needs of different people. There are people who are living in the e-commerce era. They are used to getting everything in 10 minutes or 20 minutes on a click of a button. And those are the problems that can be solved through digitization. They can be solved. So we rolled out one mobile app, and there has been a phenomenal response. 50% of our appointments are now happening through mobile app. Most of them are all prepaid. That obviously reduces the pain and inconvenience that people feel when they visit our hospitals. We also have one UHID. That means that there is a bit of data interoperability that we already have among our 27 hospitals. What we don't have today is the connection of that ecosystem with the insurance providers, with the government providers, pairs that we are working with closely. And the examples like what has been done in the Andhra government is obviously extremely inspiring for all of us. And the great thing is that both the government and the private players are working together on this whole mission. And so human emotions will remain as is. Can't replace them.
Yes, absolutely. There's technology, but it does come with its boundaries. But Dr. Arora, it's not just about bringing in digital health. We are also looking at the scalability. But at the end of it, it also needs to be sustainable. What steps are we taking for that?
So, the most important lesson we got during last 2.5, 3 years is that we can build robust systems which can manage huge population, COVID. And the other thing is that over the time it has become more and more client friendly. Clients are basically two health providers on one side and actually the subjects, patients. Because I do not know whether you are aware, in COVID platform, if I get a vaccine and I develop some adverse events, I can enter it myself. and immediately the health system is alerted and they have to come back to me. So that is. But the important thing and the point which have been raised by Dr. Babu and Madam about two things. One is interoperability. Now, Andhra has got one digital program. There are various states have various apps and programs. So one of the most important thing is in this country you allow local flexibility, but there has to be national connectivity. So that interoperability is something which is very important and that is being built up. The second is a very important component in healthcare is hybrid approach. And to begin with, I must share with you that in AIMS, there are not just AIMS Delhi, but in fact we are coordinating and ensuring that within next 3 to 4 months, all AIMS come up with a very patient-friendly and community-friendly healthcare system based on ICT, where one is waiting times and the system is responsive and respectful on one side. There is a face-to-face. But those who are coming from distance, they come only when it is actually required. So you can have follow-up visits while you are at home itself, directly, that kind of a. So a hybrid system which works both, which takes care of the human dimension, as well as we take the best use of the technology, we make it more efficient, we make the whole system more respective and responsive.
In fact, talking about schemes, now one of the most ambitious ones by the Andhra government has been Dr. YSR Arogya Shri scheme. It is a flagship scheme of your state. And interestingly, it promises no cash treatment. How do you make that sustainable? Because many of the states who would be interested in making that a template would also expect to know how it's going to be financially viable on the state coffers as well.
Yeah, this is a scheme which Andhra Pradesh government has taken up very prestigiously. You know, when the Dr. YSR was the Honorable Chief Minister, in 2007 it is started. And when Jagan Mohan Reddy Saab has taken charge in 2019, he wanted to completely refurbish, basically strengthen the program. His idea is the patient should, whatever disease costs more than 1,000 rupees has to be covered in Arogya Shri. He should get a free treatment. Almost now 3,255 procedures are covered under Arogya Shri, and less than 5 lakhs, whatever the family income less than 5 lakhs, all are covered. Generally, the treatments up to 5 lakhs for family are covered. And some of these cancer and expensive diseases are covered without any cash limit. Almost in cancer, we are covering almost average around 18 lakhs also certain patients. But it is, as you told, it comes with cost. Almost we are spending around 3,600 crores per annum on Arogya Shri. But our Honorable Chief Minister says, because it affects the poor people, because out of pocket expenditure on health is high, the poor people have to be supported and they should be insured, whatever may be the cost. So ultimately, the common man needs more importantly,
is it sustainable in the long run as well?
Yeah. So our priority is to have preventive care. That is the reason why Honorable Chief Minister has come up with a family physician concept. Now each 30,000 population is having a primary health center. And each primary health center is having 2 doctors, and each doctor is mapped with 6 to 7 village secretariats with 2,000 population. So there is a mobile medical unit going around the villages, coming twice to every village of 2,000 population, twice a month. So the doctor will come here and entire NCD, non-communicable diseases, all the data of the people are already available in the app. Because Andhra Pradesh is the topmost performer, especially in creation of ABHA ID, Ayushman Bharat digital identification numbers, health identification numbers. Almost we covered around 72% of the population. We have ABHA IDs, and all of them are screened for NCD, non-communicable diseases, whether it is a BP, sugar, oral cancers, anything. So the doctor, before he goes, he knows the profile of the village. and the medicines are distributed there. So once you concentrate on preventive health aspect, maybe in a period of 3 to 5 years, the bill of tertiary care has to come down. Our Honorable Chief Minister very firmly believes that once we take care of awareness part and the preventive health part, so naturally the need for going for secondary and tertiary healthcare facilities will come down
So the
to that
hospital
extent.
bills will come down if you
That
take
is-
care of the primary health first.
Yeah.
That's a very interesting concept. Of course, we're going to be watching out for that. Now, Dr. Garg, as we have been discussing technology, there is AI-enabled medical devices, there's telemedicine, as we were just discussing, and even blockchain electronic records. How has that impacted the Indian medical fraternity and the entire health infrastructure in our nation?
All positive. So this whole possibility about having this whole data, especially with interoperability coming in, it just opens up the huge possibility. Typically, a lot of Indian doctors, of course, have had traditionally very large volume of patients. Many of them have also struggled a lot with, using the data in a meaningful manner because it has not been digitized. It was all manual. So there is obviously a lot of effort that is required on digitizing the data and getting the insights out to create some interesting the patterns as well as improving the outcomes. Now, when all this data does become digitized, which is right now happening, and every single healthcare provider is working on it today. We would expect in next 2 years, we would expect about 80% of the large healthcare providers, both government and private, to have digitized electronic medical records. The possibility of using that data to create amazing insights and improving the clinical outcomes is huge. And I think that is what is very exciting for all doctors. They must have treated thousands and, maybe there were 2 or 3 rare cases. Some of them do take the pain of, reporting it and, doing publications. 80-90% of them don't, simply because of the amount of effort that is required. And that opens up a whole new era of clinical innovation and improving the health of people, both preventive, secondary, tertiary, quaternary, whatever you say.
In that case, Dr. Arora, I'm going to come back to you because you mentioned something which is very important, that we have multiple digital health platforms right now. They all need to ensure that they operate together, cohesiveness. In that case, how has Ayushman Bharat digital mission helped in that?
So one of the key, I would say, strategies and activities which are going on at the moment is to ensure this crosstalk between various programs and platforms. And as I understand, technology has today enabled both base technology, that means Digital Health India program, and with all the state level and other programs, they can crosstalk without much difficulty. But I would like to add 2 important points here. One is that when we have this digital, we are talking about digital health, AI, machine learning, 2 challenges are there and that have to be taken care of upfront. One is ethics, because when we use AI-based algorithms, ethics becomes important, because instead of a person, now you are asking a machine to make diagnosis, screen, or make decision making. And with human beings, the error level has to be within what is gold standard. So that is one, the ethics part. And the second is confidentiality, which you mentioned, but we did not talk about it. Both these have been taken up at very highest level. In fact, ICMR is going to come up with a complete guideline. We have just prepared that in next few weeks. The national guidelines on ethics of both AI-based research as well as AI-based clinical component. Another dimension is, which we are not realizing at the moment and which is a challenge and we have to work on it, that doctors are not so obedient as we many times may think. They are very tough people. So entering data or digitizing data, when we are collecting information, it to be simultaneously entered and entered correctly, because nobody else can correct it. That becomes complicated. And I think over the time we have to learn more on this area. So that overall scenario, I can tell you that with ABHA around, ABHA is something which you go to US, you can use your database, You are in Croatia, you can use that same ABHA iPod, and in India, everywhere you want. So portability of your health data is global in that case.
And in fact, let me take that across, because you raised a very important point, that about data security. And Mr. Babu, that is something that I would really ask you, because that's what a lot of people have been very apprehensive about. 1 crore e-health records have been linked. How safe is the data, they ask?
Yeah, it is a robust thing, because NIC has taken up especially e-health records. NIC, we are operating with NIC, so it is very robust. The privacy is secured. The doctor asks the patients whether he can take his health record, and taking his mobile number, OTP will come. Only based on OTP, if he shares with the doctor, then only the doctor can see the previous health record. The privacy aspect, security aspect, definitely it is much more robust thing. Government of India is also taking up very strong measures to ensure that the data is not breached, and also privacy also is respected.
Now, Dr. Garg, one thing, and because India has a huge rural structure as well, you of course have a massive chain of hospitals, but it is at the last mile when many feel that people are being deprived of. That's where technology hopefully is going to be stepping in. Now you have, for example, telesurgery which is coming. A doctor sitting anywhere can sit and operate upon using a robot on a patient sitting anywhere else. The locations could be completely different. That would go a long way in bridging the gap, especially for the rural sector. Has India invested enough in that technology?
I think the technology has to evolve. I don't think we have reached to a point where we are, as Sir rightly pointed about, ethics. So it's not just about being able to do it, but it is also about being able to do it right. In terms of the rural connectivity, I think concepts like Common Service Center, and we are working with some of our campaigns and some of our national level campaigns like an anemia and so on, with common service centers for that last mile connectivity, to have super specialists reach out to people on the ground. Similarly, for telesurgery and training, we are very open, but I still think that getting the right connect, because you can't have a lag, you see. When you are doing a telesurgery, there is no room for lag. It has to be live, in which case you need to
And the margin of error.
There's no margin of error. So that is why, you need to have that 5G 100% infrastructure, so that what you're doing now, and we recently looked at one ambulance, which is, so I believe 5G is talking a lot about use cases in healthcare. I believe healthcare and education are the two most important use cases for 5G. And we were looking at an ambulance, which was 5G enabled, and how will that impact the possibility of healthcare. I think we've got still some way to go. I don't think we've figured out the entire ecosystem.
But at least we are on the right track.
Absolutely we are.
So we are on the right track, and I believe all our panelists will agree on that. Thank you so much. It was a pleasure to have this. Digital health, well, hopefully it's only going to be upwards and onwards from here onwards for India. Thank you so much.